introduction speaker of Dr. Keturah Edwin-Tobias. She is going to be doing a virtual presentation. She is also one of our GLODERM mentees in cohort 2, and we're really proud that she is going to be presenting virtually today. She began her career in dermatology in 2010, working at the head of the HIV and STI unit in the Caribbean island of St. Lucia, where she is located now. And she's been very active in the community dermatology aspects there, seeing patients from across the island. She consults both at the main hospital as well as the country manager for the leprosy program. And a lot of her work as part of the GLODERM mentorship program has been really building out that leprosy program there.
Hello everyone, my name is Dr. Keturah Edwin-Tobias and I'm from the island of St. Lucia. Today I'll be presenting on climate change and the skin, the impact of the 2023 heat wave on derm cases in St. Lucia. I have no conflicts of interest to declare. In this slide, we look at the impact of climate change on us. What really is climate change? Climate change refers to long-term shifts in weather patterns and temperatures. The drivers of climate change include greenhouse and aerosol emissions, change in land use, all of which act to trap the sun's heat and raising the Earth's temperature. As a consequence, we are currently experiencing melting of the polar ice caps, raising sea levels, flooding, contrasting with severe water scarcity, severe droughts, fires, major storms and hurricanes, and a decline in biodiversity. In this slide, we see several examples of climate change related dermatological conditions, and we have listed several of them. So for example, we have heat-induced dermatoses, which we will focus on during this presentation. We have things like physical injuries, nutritional deficiencies, cutaneous malignancies as well. We have issues like photoaging and pigmentary disorders, photodermatoses, infectious disease, autoinflammatory skin disease, to name a few. So moving on, heat-related dermatoses refer to a group of skin conditions that develop or worsen due to exposure to high temperatures. For example, miliaria, we have intertrigo infections, exacerbation of inflammatory conditions such as eczema, psoriasis, Hailey-Hailey, to name a few. Sunburn and increased risk for development of skin cancers, photodermatoses such as melasma, and polymorphic light eruptions are a few of the examples of heat-related dermatoses. In the next few slides, we'll focus on the heat wave of 2023 and its effects on my island. St. Lucia is well known for its natural beauty and charm, and in this photo, you can see the world-renowned twin peaks called the Beetles. According to the National Oceanic and Atmospheric Administration, the world experienced the warmest year on record in the past 125 years in 2023. In May 2023, the St. Lucian Met Services, along with our local Ministry of Health, issued public heat advisories advising the public to prepare and protect themselves against prolonged high temperatures expected between the months of May to September 2023. This study was inspired by a lecture on how climate change can affect human health that I attended at a gala hosted during the World Dermatology Congress held in Singapore during June 2023. A retrospective study was conducted sourcing information from the St. Lucia Health Information System, our electronic database. Data was retrieved on the documented diagnoses for patients seen at the various clinics from May to October 2022 and was compared to the data over the same time period, May to October 2023. The total numbers of heat-related dermatoses were identified and analyzed to see if the heatwave of 2023 had impacted on the incidence of heat-related dermatoses seen in our dermatology outpatient clinics. The graph shows a comparison of local maximum temperatures recorded between the months of May to October 2022 and 2023. September of 2023 was the hottest month on record, at least over the past 5 years, at 32.5. The red stars on the map represent the 7 locations from which dermatology clinics are delivered on island. Using our electronic health system, I was able to retrieve the data on all the patients seen at the government-run dermatology clinics, 7 in all, across the island, from Grosley in the north all the way to Vieux down south. From the study, the most frequently recorded heat-related dermatoses were as follows: inflammatory conditions such as atopic dermatitis and seborrheic dermatitis, followed by infections, specifically fungal, then bacterial, papular urticaria, miliaria, and intertrichal. 927 patients were seen between the months of May to October 2022 versus 1,003 during the following year, same time period. 59.55% of patients seen during May to October 2022 had at least one documented heat-related dermatoses as compared with 59.82% in 2023. Despite record high temperatures recorded. The calculated p-value was greater than 0.05%. Therefore, the difference recorded in the number of heat-related dermatoses between the months of May to October 2022 versus 2023 were not very different. Simply put, the data does not support the assertion that the heatwave of 2023 caused significant increases in the numbers of persons who sought treatment for heat-related dermatoses. However, it does not mean that the heatwave did not have any effect on persons in 2023. There were several limitations which may have affected the outcome. The sample size was relatively small. Many cases may have been seen and treated effectively by the district medical officers, favoring underreporting, and many patients self-medicate. Only one clinician reviewed all the cases, that's myself, resulting in the possibility of the introduction of personal bias, and the study was also done retrospectively. We're finishing up, folks. As healthcare workers, we should counsel patients in ways to mitigate the effects of climate change, in this case, namely the heat on the skin. Remind persons to wear light, loose cotton clothes, use repellents, mosquito nets, keep hydrated, drink less alcohol. Remind family members to pay special attention to older persons and younger children who may be unable to articulate their needs and more susceptible to the effects of heat. Be mindful in your prescribing practices with certain medications listed prior, antihistamines, anticholinergics as well. Avoid going out for prolonged periods during peak sunlight hours, namely between the hours of 11 and 2. Make sure that we use sunscreen properly and utilize other forms of sun protection. Yes, folks with skin of color, please remember that we all need sunscreen as well. Above all, keep cool. In closing, I leave you with these photos. Those on the left show the environmental impact of climate change in my country, and those on the right illustrate several patients with heat-related dermatoses, aka the impact of climate change on the skin. I thank you for your time and attention. I would like to leave you with these parting words. Ilse Levin of the American Medical Association is quoted as saying, "Taking action now won't reverse all of the harm done, but it will help prevent further damage to our planet and to our patients' health and well-being." I'd like to take this opportunity to thank you for your time and your attention and the opportunity to have presented at this very prestigious forum. Thank you. These are my references.